Good afternoon. We're going to start our press conference. My name is Osman Ahmed, Osmanahmed. I'm the Director of Advocacy at CAIR Minnesota. We're here today. We just came out of a meeting for emergency meeting for autism safety and prevention, and we have great speakers lined up here. I just want to share that hopefully this will be the first initial meeting of many meetings to come. But I just want to say that has been great morning and great meeting. I want to start with Chailan Hussein, Executive Director of CAIR Minnesota.
Jaylani Hussein, Jaylanihussein, Executive Director of CAIR Minnesota. I'm really proud of today to have this incredible people here today, the leaders and community organizations that have been on the front lines of supporting families who have children with autism. This morning we had over 2.5-hour meeting where we sat and discussed with our state legislators, some of those who will be with us at this press conference, about the urgency and the immediate actions that are needed to safeguard children with autism. In addition to that, to discuss holistically some of the challenges that many of the families with autistic children in the state of Minnesota are facing. We just learned this statistic today, this morning, and I'll have some of the other leaders expand on it, but we believe that 8 children with autism from the Somali community died in the last 3 years. This is not only an alarming number, this is a tragedy upon tragedy. The East African immigrant community, in particular the Somali community, have the highest percentage or the highest percentage for being autism, according to the state of Minnesota's, University of Minnesota's research. 4-year-olds, about 1 in 16 children have autism. That is the highest of any group in this study. We have been challenged by this, and the community has faced a lot of different challenges as it relates to taking care of autistic children, gaining and accessing resources that exist, and also creating the opportunity for additional resources. Today we had a very lively discussion. There was a lot of incredible ideas and insight that were presented where we were able to document that. We are created an unofficial task force this morning with this group of folks, and we are calling on the Governor Walz and the Lieutenant Governor Peggy Flanagan to take this matter seriously and to make an official government task force that will present necessary steps and ideas and projects and specifically funding to address this emergency that our community is facing. I have the unfortunate experience, as many folks who are behind here, to be on the ground when we were searching for Awais and Muhammad. This past summer, we searched for Awais, and I saw hundreds of people coming out to search for him, only to be found literally next to his apartment in a body of water. And we know that children with autism often drown, and 91% due to their love for water. That was a very traumatic case. Obviously, it's on the back of these 8 children that have been died in drowning. But what was perhaps even more painful is the death of Muhammad, who just died a few weeks ago in Eden Prairie. What is starking is that both Awais and Muhammad share almost a similar story. A family struggling to take care of their autistic children, many preventative things that could have been put in place that were not. And today we learned that there is so many gaps in the DHS services, in funding for organizations who are behind me here today, who are the first call that families call out or reach out to. We learned issues in housing that need to be addressed. We learned issues specifically with safety and safety equipment. We've also learned some of the gaps in accessing the resources that already exist, that children with autism are unable to get and access those resources. So today we are reaching out to our Minnesota family and asking that the families with autistic children need your voice. We as a community need to come together. It is completely unacceptable. And in a state where we have the resources, the manpower, and the intelligence, and the community partners who are on the front lines, we should be able to resolve this issue. We will not rest until we make sure that our state is the safest for families with autistic children, and we provide every necessary tool that they need. We need to listen to the families, and we need to do something. We asked Governor Walz and Lieutenant Governor Peggy Flanagan, the leadership of the state. We're asking them, in addition to Senator Muhammad, who's been a leader in this effort today, who met with us today, we will hear from, and other, Representative Fisher, and many others who reached out in urgency of this matter, to take this matter seriously and to see the results by protecting our children. And to the public, we need everyone to learn about autism, to support the families and the neighbors who live next to you. Some of you can be a voice for these families. You can reach out to them and provide us support. And we need landlords across the state of Minnesota to know this one fact. You have as much of a responsibility to ensure the safety of the children who are disabled in your care and in your facilities and in your homes. You must do whatever it takes to make sure that those families have the support that they need to ensure to protect their children. And I will promise any family who has concerns about their landlords to contact CAIR Minnesota, and we will do everything possible to ensure that those families are taken care of and safety measures are enacted in their homes to ensure that their children are safe. Thank you.
Thank you, Jelani. Before I call our next speaker, I just want to make sure that we are very excited the meeting happened this morning and we got our group together. But I sadly, this will not be the last case. Last couple of Sundays ago, when I got to the place where Muhammad, was missing, an hour later, all the neighbors, they worry about the next child, next neighbor. They told me there was another kid who is like 8, 9 years old, who has been actually saved one time, same place Muhammad was thrown like a week or maybe later, not long ago. So I want to call Mahdi from Somalia Parents Autism Network.
Good afternoon. My name is Mahdi Warsama, M-A-H-D-I, first name, last name is Warsama, W-A-R-S-A-M-A. I'm the CEO of Somali Parents Autism Network. So the families of children with autism are panicking due to the back-to-back drowning of those two Somali boys within 4 months. So in light of what happened with the drownings, the organizations that serve the children with autism, whether they are advocates or service providers or academics, got together and decided to meet with the state representatives and senators. So we had a very good, productive meeting today. Senator Muhammad was there, Representative Fisher was there, and many staff members were also there. So there were 4 main concerns that were discussed. Number 1 was child with autism safety, and we gave them 7 recommendations about what we think should be enacted as a law or as a policy. We also talk about why it's absolutely necessary to fund and appropriate funds for the cultural specific and linguistically specific services and the organizations who are in the field who are doing the job, such as SPAN or MAN or Mangard, the organizations that are here behind me, why it's necessary to appropriate funds for those organizations that are in the field, that are doing a system navigation, educational workshops, public awareness campaign. We discussed that. We also discussed about what can we do about the long waiting list of waiver services and initial diagnostic assessment services of autism, what the government, the state can do and how we can streamline the services. We also talk about the housing discrimination that the families with children with autism are facing, particularly when it comes to doing a home safety installations or home modifications to make sure that the children do not exit the home without notice. So we shared our recommendations and our policy recommendations with the state legislator, and we intended to follow up with, and we expect the action will be taken. Thank you.
Thank you, Maddie. Now I want to call Ali from Autism Society of Minnesota.
Okay, my name is Ellie Wilson, E-L-L-I-E-W-I-L-S-O-N. I'm the Executive Director of the Autism Society of Minnesota. We at Awesome were very excited to attend this very productive meeting today with a multitude of community partners to discuss something that's incredibly important to the entire autism community, but something that is particularly and deeply painful to our Somali community members who have been disproportionately impacted not only by autism, but by the link between autism and safety concerns related to drowning. Many autistic children do experience a behavior called elopement, which is basically another word for wandering away from somewhere that is safe. This is something that we can predict as part of their diagnosis, and oftentimes in Minnesota, in our land of 10,000 lakes, wandering can actually predict an even more dangerous circumstance, which is a child near water who may not know the safety implications of being close to water, regardless of the time of year, regardless of whether or not they have ever learned to swim. So this group is really working hard to articulate solutions to a problem that is very difficult to solve. And it's going to take not just these organizations here or the legislators that we hope listen to us today, but also to the broader community to be aware of this pattern. Many, many people are affected by autism, 1 in 34 in the state of Minnesota and 1 in 16 amongst Somali families. That means that everyone listening at home likely knows an autistic child, and what we plead for you is to support our organizations so that we might be able to access some solutions. Some of these solutions are going to be oriented around fair housing and access to supports like home modifications so that it's not easy for children to leave the home unattended. Another thing that we're focused on very closely is access to swimming safety and survival lessons. It's a very common practice for children to get swimming lessons here in Minnesota. We want to make sure that that right is extended to autistic children as well as those in the BIPOC community like the Somali community. Finally, we're also asking to consider emergency response technologies and protocols on behalf of lots of different emergency responders so that we might be able to have a more timely and well-informed response so that perhaps we can prevent absolute tragedies like Muhammad this past week. I think the last thing that I would like to say is just that although this is something that affects autistic people specifically, this is a danger that I think all Minnesotans can relate to. It's part of the inverse of the wonderful opportunity to live in a beautiful state where water is part of everything that we do. What we need to do is ensure that these children with an autism diagnosis have the same access to community that we enjoy ourselves. And to do that, we have to break down this problem solving into solutions that we're going to see in policy and in program. And that's it. You're just going to tell the story, man.
Thank you, Ali, for that. Before I call our next speaker, who is a mother, also have been advocate for autism in the Somali community. I've seen her work a lot. She's with MAN, Multicultural Association of Network, correct?
Close. Minnesota Autism Action Network.
Thank you. Good afternoon. Thank you. My name is Fatima Molas, F-A-T-I-M-A-M-O-L-A-S. I'm a mother of a beautiful 12-year-old son with autism. I'm here today because I'm the co-founder of the Multicultural Autism Action Network. I'm a community advocate. I'm heartbroken to hear yet again, another near drowning happened in our community. Muhammad was one of 8. In 3 years, we lost 8 children. This could have been one of my kids. My son eloped 1 week twice. I cannot imagine the feeling these parents feel. I sent my condolences and my heartfelt, condolences to these parents. I'm heartbroken that we're here again, yet for the same reason, asking for help. All we want to do is to make sure that these families of children with disabilities and autistic children have fair access, services. There's a wait list. When a child gets diagnosed, the wait list to get diagnosed is about 18 months. County services about 6 months. So in that period of time, that family is dealing with a child who has behavior, doesn't have a house modification. We are dealing with the discrimination with the housing. We can't get locks because it's a fire code, a fire hazard. What happens when that child escapes? We need to make policy change around autistic children. We also need to make a change in getting access to services to make the wait list shorter. We also make sure when we send Amber Alert, there has to be a specific Amber Alert for autistic children. There cannot be Amber Alert hours after the child has been missing. We know that if a child escapes, they're 99% more likely to end up in the water. So please, when we call the 911, we want to make sure we also call the DNR and the people that know how to deal with the water, immediately go inside the water. We had volunteers for our Oasis case. There were a delay in getting into the water. So you hear autistic kid is missing, autistic child is missing, get in the water. Because we know that that child is more like being in the water. What else do we need help with? Give access to swim lessons. It's a basic thing you can do. These children need to learn how to swim. Support the families, support the mothers, support Minnesotans. We have 10,000 lakes, but it's like we have 50,000 lakes in Minnesota. So we want to make sure every Minnesotan child learns how to swim. Thank you.
Thank you for the water. A couple of Sundays ago, Muhammad's mom keeps saying, my son is in the water, right? From the beginning until they found him. So mothers know the best, their intuition. Now I want to call Amy from the University of Minnesota.
Hi, my name is Amy Hewitt, A-M-Y-H-E-W-I-T-T, and I'm the director of the University of Minnesota's Institute on Community Integration. As a part of our work at our institute, we run the Minnesota Autism and Developmental Disabilities Monitoring Program, which gives us prevalence numbers of autism in the state of Minnesota and contributes to the national findings as well. In Minnesota, in the Somali community, 1 in 16 4-year-olds and 1 in 25 8-year-olds are identified as having autism, and this is significantly higher than other groups of children. With that, we've known the prevalence of autism has increased over the last 10 years exponentially, and yet our service system, the supports that we need to get to children and to families, have not caught up. They haven't kept up to meet that demand. And so we have very long waiting lists for children to get services, 15 to 18 months. We don't have enough professionals in the field who can provide services and supports in culturally responsive ways. And we aren't graduating enough professionals in our universities. So we need to increase the capacity of our system to provide supports. When I hear news stories like the 8 children who have died in the last 3 years, what is heartbreaking about it is those are preventable. If families had access to the services and supports they needed, those drownings were preventable. And as a state, I think we need to do something about that. To our communities, I think we all have a responsibility. We have a responsibility to get to know our neighbors, to know when there's a child with autism living in our neighborhoods, and to help families support their children who have autism. We need family support. Many parents go night after night after night without sleep, and that drastically affects their physical health and their emotional well-being. And we need to make sure that our policymakers are creating services and supports that meet their needs. To our policymakers, we need to break down some of the policies that are limiting access. There's some simple interpretations of regulations and policies that could be changed. They just aren't being changed, and that needs to happen. And to our elected officials, we need funding to support the services and supports that children and adults need if they have autism. Thank you.
Thank you, Amy. Now also, our next speaker is a mother who is a mother of two autistic children, and also she's with Mangar Global. Ayan
Good afternoon, everyone. My name is Ayan Musa, A-Y-A-A-N. Last name Musa, M-U-S-A. I want to thank everyone that's here today and everyone that attended the meeting with us this morning. It was a very productive discussion. I am a mother of two children that have autism. I'm also the executive director of Mangar Global, a nonprofit organization that helps families navigate services, to educate them, and just overall support. We do work with the government as well, addressing different issues. I am not the only parent that has taken it upon herself to learn as much as possible to help my children, and in turn help my community. Parents like us do invest a lot of time in trying to navigate the system and learn about it. And I believe that they are the best allies that anyone could ever ask for. The organizations that are here today work day and night without much funding, if any funding at all. So what we are requesting from the government is to be invested in our cause. Not just financially. Finances are definitely absolutely important. But if they do not know our cause well enough, they cannot empathize with us. And lack of empathy is what we're dealing with here, and it has many, many grave consequences. The rates of autism, according to the CDC, have started rising in 1990. We are at the end of almost 2024 today, and the government research all these needed supports are just playing catch up year after year after year. That means that the collateral damage are our autistic children and their families. We ask that we be more invested in our communities and neighborhoods. We need much more awareness of autism, a lot more education, not just for the parents and those that have family members or are autistic themselves, but the community and the state at large. Because if we do not have the support of the community we live in, how are we expected to thrive? We ask that they put themselves in our shoes and think of their children having these types of needs. We need mental health to be heavily, heavily invested in when it comes to healing a community, but also the parents. We've heard today that many parents go without sleep for a long time. A mom that's exhausted is not going to be able to keep her eyes open and watch that child 24/7. The services that are offered through the counties come up short. We know that sleep issues are prevalent in the population of people that have autism, yet night supervision is denied to parents. Enough support is not given. Whenever an assessment is done, it feels like an inquisition. And we are asked again and again to prove why we need these services, why our children need these services. Yet all the research shows the traits, the difficulties that people face. Why is it that we are burdened with proving that our children need these services when already there is so much information and training that has been provided all these years? So we do feel marginalized, we do feel unsupported, and we ask the government to live up to its responsibility of taking care of every person that has a disability, every family that's struggling to care for their children or their elderly. This is basic. Our children are entitled to be safe, to be educated, to receive the services they need. There is a rule that says parental responsibility. This role is often used to deny services to families. Our children have extra needs. If they are not developing at the rate of a typical neurotypical child, the gap that exists has to be covered by the county. Yet, especially with young children like Awais, he was only 4 years old. They will say parental responsibility in order to deny PCA or just help for that kid, saying that he's 4 years old, this would have been your responsibility anyway. But no, it's not true. It's factually wrong, and it is devastating to know that government services have such gatekeepers and ignorant mindsets, to be honest, about what autism is and what services are needed based on research. So today I would like to say we are part of your community, you are part of our community. There's no us, there's no them. These are our children that we're talking about that have a right to be safe and secure at home, at school, out in the community. And parents deserve your love and care. So we ask you to please make sure that you remember these families and do what you can to be a good citizen and help your fellow human being. Thank you.
Thank you, Ayan, and to all of you. Ayan told me she was nervous before she was coming here. But you know, those are personal stories and personal experiences are, exclusive. You can't take that away from anyone. So thank you. We're almost done. We have 2 more speakers, and then we'll have Senator Mohammed to close the press for us, and then we have open for questions and answers. So next, I want to call Mariam from Multicultural Autism Action Network.
Thank you so much. Hello everyone, I'm Maren Christensen Hofer. It's MAREN CHRISTENSON, and the second last name is HOFER. And I am the Executive Director of the Multicultural Autism Action Network. And I'm also the parent of a child with a disability myself. And I'm very grateful for all of our partners standing with here today to talk about safety. I know many of my colleagues have talked about many different proposals, and some of them are cost money and some of them take time. But I'd just like to talk to all of our community about something that's free, and that's compassion. That's kindness, that costs us nothing. And I would invite all of us who are listening today that have families of children with disabilities in our communities, in our schools, in our mosques, in our churches, to greet that family with kindness and compassion, to reach out, to make sure that those children are included and welcome, and that we show up for them and make sure that those families have everything they need to feel part of our community. There's a lot of big problems that we're trying to solve here and a lot of really difficult issues, but making sure that people with disabilities are included as part of our community costs us nothing. Thank you.
Thank you, Mara. And now I want to call Jillian Nelson from Autism Society of Minnesota.
Thank you. I'm Jillian Nelson, JILLIAN NELSON. I'm the Public Policy Director for the Autism Society of Minnesota. As an autistic adult, every time I hear the news that we've lost another child with autism to drowning, it's a devastatingly crushing feeling. We have known for decades that the #1 leading cause of death in the autism community for children is drowning. Drowning is 100% preventable. It was an honor to gather with this amazing group of people to begin the building of a coalition to tackle very important legislative priorities in January of 2025. We cannot change what's happened in the past, but we can gather and legislate to make sure that every single autistic child has a chance to grow up and become an autistic adult. And we can do this simply by changing housing policy, by creating ease of access to swimming safety and survival safety, by allowing our families to access the disability supports that are their tax-paying right without jumping through unsurmountable barriers that even those who are most informed struggle with. Our children deserve a future. Our children deserve a chance to grow up and be adults. And if there's something as simple as a body of water standing in front of that, we as a community, we as adults, we as Minnesotans owe our children a future. And we can do that by coming together and making changes to assure that not a single autistic child drowns again in Minnesota. Thank you.
Thank you, Children. Before I call the senator, I just want to say that again, remind us the group that met this morning were organizations, parents, leaders, and also we had many House members and their staff at the meeting. They couldn't be with us today, but also we had a staff from the Minnesota Department of Health at the meeting as well. So this has been very large group of people from different expertise and different backgrounds. And I want to personally thank for Senator Muhammad for helping us organize this and also calling this by organizing for 7 days for this meeting. So that was very quick turnaround, and we hope to work with you.